Hey everyone, welcome to episode 3 of Frank About Health. I'm calling it Prescription for the Future. Today's show is being streamed on talkradio.nyc, and you will be able to eventually hear the show after the podcast is complete. First of all, I'd like to say over the past 2 weeks, we've discussed epilepsy, alternative treatments, and the social issues surrounding healthcare. As I've said before, the aim of this show is to erase the myths, the misconceptions, and stigmas associated with epilepsy and many other illnesses. Today promises to be entertaining in that we are looking at the financial impacts and effects of healthcare in this very big industry, to say the least. The United States market has pretty much taken those with chronic illness to seek more cost-effective means of treatment. We have focused on alternative care, which is expensive, such as acupuncture, music therapy, body and brain teachings like yoga and meditation. However, we still have people with chronic illnesses that have to continue their pharmaceutical treatments, essentially for chronic illnesses like epilepsy, diabetes, leukemia, other kinds of things that just unfortunately require medication, but in this country have proven to be very cost prohibitive. As one who suffers from epilepsy, I've had to integrate my medicines with acupuncture to at least maintain my quality of life. However, due to the fact that I have a disorder that requires multiple medications, I've had the chance to meet with one of our guests today. His name is Jordan Rosenblatt, and his father, Rob, who are on the line and will be announced shortly. Essentially, I met them 6 months ago when I needed to find another place to find my medications. It turned out it was in Canada. However, I personally went in order of trying to be able to understand how the Canadian pharmaceutical market has a comparison to the U.S. market. Now, both of them over at Mark's Marine Pharmacy are very informative, enlightening, and very helpful. Today, my co-host, Dane Krislevich, who's continuing from last week, will make us to be frank about the financial aspects of healthcare by providing important questions and having them answered from our guests today, and therefore providing the understanding that a lot of people out there do have. It's just they don't know how to ask the right questions, and thanks to Dane, he'll be able to enlighten us with them. In the meantime, during the show, if you would like to reach us here at Frank About Health, please tweet me at hashtag FrankAboutHealth or use my Twitter handle, FrankHealthcare. I will personally respond. Now, so Dane, before we announce our special guests, I'd like you to explain to me what you mean by the tagline that you've undertaken, too big to not know about. Can you explain what you're referring to?
Yes, thank you very much. Like I mentioned last week in the show, the health industry within the United States is about $1.3 trillion US dollars being allocated each year. If you put that into perspective, that would make the U.S. healthcare system the sixth largest economy in the world. And that's just one segment of what we spend on, produce, and also allocate our resources to in the United States. That's approximately 15 to 16% of our GDP, but at the same time, it consumes a lot of our everyday lives in terms of, people being concerned about what the next year is going to bring in terms of what their health care premium costs are going to be, what their prescription drug meds are going to cost, how do they have to, sift through different types of, information to be able to provide to their doctors. So the whole system has changed, and looking at it, too big to not know basically means that, we as people need to have a funnel of information that we could then bring down, and actually make it tangible to our everyday lives.
Right.
Just this week, there was a lot of news reports coming out that sent a little bit of sticker shock, talking about for 2017, with the Affordable Care Act health plans, what those might cost going into next year. The state of New York could rise by 17%. The state of Virginia, 23%. Oregon, 30%. Now, when you look at that, originally we were supposed to have a pure supply and demand, where if you have more people insured, it should be driving down the costs.
Right.
That in the early stages doesn't seem to be happening. And when you look at this, people need to then see, okay, how can I budget for stuff, but also how can I find, ways in which I can, reduce my outlays in which I have to pay for things. So
Right.
I think that, in the United States, more people are going to be exploring medical tourism, for one thing. Another way in which what we've discovered is that you can actually source your medications from outside of this country, right across the border, at a significant savings. Within that, what we want to do is be able to explain sort of how people can channel that information to their friends, their family, their coworkers, and then explore that because, within this inflationary environment, every dollar and cent does count, especially when the unknown for the future is present. So therefore, understanding broader topics of health, it really is too big to not know things about. And so I think that's, what we need to do as, aggregators and analyzers of information is provide that out to the general audience.
I agree. As a matter of fact, as I've been talking about alternative treatments, they themselves today are not even affordable with insurance, even if you are prescribed them by doctors. So as Dana's been talking about, too big to know, what you're understanding is not only are alternative treatments not covered, but in addition, branded drugs are consistently not being covered by improvements, as they say, in healthcare, insurance, and other kinds of issues, which we're not going to really delve deep into today. The reason why our guests from Mark's Marine Pharmacy in Vancouver are here is because they are providing a different perspective about how both alternative and holistic medicine, in addition to obtaining the drugs if you are reliant upon pharmaceutical treatments, they're going to be able to show that there is still a means of getting cost-effective medications. It's just, unfortunately, you have to really look elsewhere if you're not finding the consistency within this country. So before I go ahead and announce them, I'd like to pretty much tell you there's only one slight personal experience I have with Mark's Marine Pharmacy. Of the two people, one of which is my personal pharmacist, I have learned a lot in terms of how everyone knows or learns that there is hope in finding what they need. It isn't as restrictive as a lot of people can find, especially if they're not given the correct information. So I'd like to know, Jordan and Rob. Rob is his father, Jordan Rosenblatt. Are you available online at this time?
I am. Yeah, this is Jordan speaking.
Awesome. It's really good to hear from you again. How about your father? I've never personally met him.
Here, thank you for having us.
Great. And you're very welcome, and thank you for coming on today's show. I find this particular episode to be pivotal in terms of explaining to the numerous audience reactions that I've been getting since I've had the last two shows. I know that there are a lot of listeners that are on Twitter and Facebook and, of course, on talkradio.nyc. What I'd like to know is you and Dane are going to have a discussion that kind of mirrors what he's already said about a lot of economics of healthcare. Is there one question you may have, or Dane, would you like to start the conversation?
Hi, Jordan. Hi, Rob. Thank you for joining us today. I think that one of the things that I'd like to just kick it off with is if you look at, before we go into exactly what Mark's Marine does, what they are, how they're structured, and how people in the U.S. could utilize them. The biggest issue is in the United States. If you look at drug inflation, it continues to rise. In 2015, the cost of prescription meds they jumped up by about 15%. To put that in perspective, each American spent approximately $1,500 on their prescription drugs in that year. They're anticipated to rise going forward. In Canada, I was doing a little bit of research, and it looks like the average Canadian spends about $950 per year on medicines. Unfortunately, the United States, we always want to be number one in everything, and we are number one in the spending with prescription drugs. Canadians always want to be at least a close number two or even a number one, and you guys are number two on a global basis in terms of spending. But if you look at it, it still accounts for a roughly 50% savings of what the average Canadian spends. By contrast, looking at all this, we want to see, delve down into a little bit of the history of Marks Marine, what you're doing, how you are then exploring the U.S. market as, a big opportunity. And also it's a good opportunity for the United States people as well. So if you want to just give a general overview of your location, your history, your scope of your customer base through Canada, the United States, let's please touch off with that, please.
Okay. Our pharmacy is located in Vancouver, BC. We're a licensed pharmacy, licensed by the province of British Columbia. And we've been in business basically for 48 years. And we're located within a medical clinic. So all day long we'll fill prescriptions for patients coming in from the medical clinic. And over the years, since we're very close to the border, and Vancouver is a very popular destination for tourists, a few tourists would come in, and over the years, and as the word spread, we became more and more popular as choices for their prescription drug requirements. So that's how it evolved over the years.
Interesting. And so if you look at that, has there been a timing in which your business really started to grow? Within the 43 years of, being in business, and you are a family-run business, the business that comes into the United States, when did it actually start to, kick off and grow?
About, Jared, do you want to answer that?
Actually, Jordan, I'm getting an understanding that we have to take 1 minute break. I like the overview that you both have provided. Thank you so much. We'll be back and definitely continue on with Dane's prescription.
You're listening to the Talking Alternative Network.
Hello, I'm JC.
I'm Joan. And welcome to 21st Century Entrepreneur.
We bring education,
insight,
knowledge,
awareness,
trouble,
craziness, and fun
for you, the entrepreneur who's looking to build your business
and your community. Listen every Friday from noon to 1 Eastern on talkradio.nyc. And you can tweet us at 21st CE Radio or Talk Alternative.
Talking Alternative Radio, 24 hours a day.
Hey there, all you tweeters, Facebookers, and anyone who's listening to the show right now on talkradio.nyc. My name is Frank Harrison, and you can reach me at Frank Healthcare, hashtag FrankAboutHealth. While you have all that awareness, we had just been speaking with both Jordan and Rob Rosenblatt of Marks Marine Pharmacy in Canada at the British Columbia province, and they were starting to explain something very pivotal to Dane, and I'd like that to continue.
Yeah, thank you guys. So we touched upon before the break, just looking at when your business into the United States might have started to grow, and then, how it has grown and what you see are future opportunities within that.
So it really started to pick up about 10 years ago when we started to develop relationships with doctors who started finding out from their patients the benefits that we can offer them and the significant savings. There's many factors that contribute to things. For example, the patent laws in the U.S. last 10 to 20 years, where here in Canada, they last 3 to 5 years, and generics have to be therapeutically equivalent. At the beginning of the show as well, you were talking about the yearly increases in percentage to medicines. But in the States, it's not uncommon that medicines have doubled or tripled in 1 year. So Americans are just getting fed up, so they started looking elsewhere. And especially over the last 2 years, phone calls have grown exponentially, simply because people are becoming better educated and more aware about the options out there and why we're different. If you look online and you search up and you go into any search engine and look for a medication, you're going to see a ton of different websites, but it's sad that 99% of those places that sell medicine, they are not pharmacies. They're websites, they're entrepreneurs, they're not a pharmacy, they don't have a pharmacist, there's no quality control. So that's the one part of my job I have to tell you that I don't like. People who call up who shopped based on price and price alone, who had a bad experience. So when they find us, whether it be through their doctor or their own research, we get the privilege of talking to some very happy people and developing long-lasting relationships with many people over many years.
That's a great point, because it seems like you could search for information, you could find it, but if you don't really have someone that is trained, educated, and be able to, especially with medicines, you have to be able to have someone that knows exactly what they are, how they should be used, what the side effects would be. So can you touch on, I know Marks Marine is very customer-oriented, customer-friendly. You have, a big number of, trained pharmacists on staff. What are in terms of how your business is run, the communication between the clients via phone, via email, what is the general mix of that?
I'd like to answer that one. It's a really great question. I think an important point I'd like to make is we do not sell products. We sell medicine. And that's really, really important, as you mentioned, with the side effects and the knowledge for the medicine. So it's really important to become an educated consumer and have that doctor, patient, pharmacist, patient experience, because there's a lot to know. So we primarily do everything over the phone. We prefer that method. Even though we have a website, we can really provide that information, education, guidance, and support via telephone. That way a pharmacist is always a phone call away. And back to my point before, there's a big difference between an internet pharmacy and a pharmacy that has a website. An internet pharmacy is just a place you go to, you can shop online, and that's about it. You don't know who they are, you don't know where the medicine's coming from, you don't know who makes it. There's no traditional experience. Whereas with a pharmacy like ourselves, you get that traditional pharmacy experience and the pharmacist relationship. We do, of course, have a website, so you get a little bit of insight as to what we do with the price list. But that way we can really develop a relationship, a lasting relationship based on health and giving proper health care.
Mm-hmm. So that is an important issue in terms of the quality of which the Marks Marine products that they are using. Your team of pharmacists obviously would hold to the highest standards the products that you dispense, whether they are long life drugs, natural medicines, vitamins. So if you could touch on that in terms of, not only is it for pharmaceutical drugs, but also you guys do a lot with natural medicines and vitamins.
Rob? We've actually, have quite an extensive line of top-end holistic natural products. And over the years, in my experience, maybe 15 years ago, 1 out of 1,000 seniors would take vitamins, and now it's completely turned around. 85% of seniors have some form of natural products in their medicine cabinet. So that's through the awareness, and especially through the internet and the education that you can get on the internet.
But on that point, a lot of the stuff on the internet can be misinformation, and with more people taking medicines, you get more manufacturers making medicines. And quality is key. Because you get active and non-active versions of a vitamin, and you get synthetic and natural versions of a vitamin. So people aren't aware of the differences. Over and above that, holistic medicine is very different than natural medicine. Natural medicine is just taking a medicine that's not a chemical and applying it to a symptom, just like a prescription medicine, to mask or calm down the symptoms. Whereas holistic medicine is looking at the whole picture of that specific patient, medical history, genetic predispositions, medications they're taking, diet, which we do diet diaries with our patients, or testing through blood or saliva antibody testing, and formulating a plan specific to the individual, so targeting our efforts. And the more targeted our efforts, the more success we'll have. So we really, whether it be prescription or natural medicine, we have the specialists here on staff, from pharmacists to naturopathic practitioners, to personalize every order with each patient and talk to each patient to see how we can best be of service.
That's interesting. So that you could have callers coming in and talking to you about their prescription drugs, but also their holistic medicines that perhaps they didn't have much knowledge about. And so it seems like you are consulting them along the way, helping them out, and in general, building a healthy relationship with them over time.
Yeah, we like to tell people we're basically your corner drugstore that happens to be a few miles away, and we're able to be contacted just by the phone, and we're happy to speak to everybody.
And we're proud that we have a full staff of highly educated people who can talk to our patients, whether it be about the services we offer, the medicines we offer, and personalizing the service. So each patient that calls up will really be, each of our members of our team, of our staff, will spend a lot of time with each patient, making sure that they know everything they need to know for working with us. And when we set an order up for the first time a patient calls, we do spend a lot of time. That way, moving forward, it's really smooth sailing. So whether it be refills or new medications, they know how it works, and it's that much easier.
I just want to interject for a second. I mean, obviously, speaking from personal experience and working with you guys, what I have noticed as a difference is that you do literally work with your patients to educate them on the value of the medications that they probably have already been taking. But when they work with you guys in the way that you have set up, I perceive you have the mission to not only sell your medicines, but to educate the individual's patients that are really looking to learn about what it is that they're just not finding in the United States. Would that be correct to say?
That's correct. Our mission statement is very simple. We are not just here to dispense medicine. We're here to provide education, guidance, and support for all health needs.
Awesome. I mean, just in general, the education, as I keep saying, would help erase a lot of stigmas surrounding the illnesses they have. Many people are upset of the illnesses they have and what maybe people in their own personal networks or even overall society, because they understand that they are living with a disability due to the fact that every single day they are taking their pill or their treatment that has them with a quality of life that in just some ways it maintains the quality of life, but it's not fully made aware of the purpose. What I've discovered having epilepsy and other comorbid disorders as a result of epilepsy is that I feel comfortable in working with you guys because I truly feel that I've learned more about my disorder and the medications that I take as a result of working with you guys in just the last 6 months. So I think that is something that is high quality into itself, and I perceive Mark's Marine Pharmacy to be one of those pharmacies that is looking to maintain high quality of life for its patients.
Well, absolutely. A day doesn't go by when somebody says to us, thank goodness I've got you, because now it's not a choice between taking my drugs and eating.
Absolutely.
So, I mean, that's an economic, but it's also a social issue here, in the States, because, people were never prepared for having to even make those decisions. It was always, you had food on the table, you had shelter, you had medical, treatments. But, right now, as we are heading into the second half of 2016, it has really become something of a huge unknown, and it's only getting more commingled with people not understanding, where there are all alternatives to, find a Marks Marine, pharmacy to be able to, have their medicines filled at a fraction of the price of what they would be paying here in the United States.
Correct. And just one more question I'd like to ask related to the United States market. I understand from our initial discussions, you have 95 to 99% of your business coming from the United States. Is that certain?
There's definitely a large percentage of patients now that are calling from the United States because of the relationships that we have with doctors. A lot of doctors are prescribing the medicines to their patients, but that service the doctor's offering provides absolutely zero value if the patient can't afford the medicine. Given those circumstances, many doctors will give out our phone number, and patients are shocked when they call their local pharmacy and hear the price of the medicine, and then they call us and hear the price difference. We're not just talking about a couple dollars. We're talking about a complete lifestyle change.
It's amazing. We're about to have another break, but I have to tell you what you've just done is mirror my existence in terms of looking for the right information, and I'm very happy in working with you guys. So, ladies and gentlemen, if you have any more questions for these people as they will continue to educate, please reach me on Twitter at Frank Healthcare, and at the same time the hashtag FrankAboutHealth. We will be back in a minute.
Hi, this is Rob Kay.
And I'm Callie Alpert.
Are you looking for a show where people talk about real stuff like life, love, the pursuit of being yourself?
Well, then you have come to the right place, because the Rob and Callie Show is doing just that. For the last 10 years, Rob and I have been having our own version of Sunday morning therapy sessions on the phone, and now we're bringing it to the radio.
So tune in and call in live Wednesdays 8 to 8:30 on talkradio.nyc.
And that's Eastern Standard Time, so join us.
Talking Alternative Radio.
Everybody, thank you for coming back to part 3 of episode 3, Prescription for the Future. As we've been speaking with Jordan and Rob from Marks Marine Pharmacy, we've been learning a lot. I have certainly been learning a lot, especially towards my future and maintaining my quality of life in healthcare. But I was interested in the last question that Dane was asking, because it looked like to me it was going to be subsequent to their strategy and their mission of educating their patients. Would you like to continue?
Yes, and I think that one question I do have is, why do you perceive the cost of prescription drugs in Canada are so much cheaper than they are, down here in the United States? I know earlier on you touched on the patent life in the United States is anywhere from 10 to 20 years, on average probably 15 or 16 years, versus up in Canada, Health Canada sets it at 3 to 5 years. Do you think that's one of the bigger drivers of keeping the prices down?
Well, I think that the Canadian government is integral in establishing the rates at which a prescription medicine can increase. Mm-hmm. I can't say anything about United States. I'm certainly not aware of that, but we do see the prices increasing double digits. We never see that in Canada. The Canadian government has rules, and over the years, and my experience over many years as being a pharmacist, we rarely get to see more than a 2.5% increase on a year, and that's really rare, and it may go by 5-10 years before medicine is even increased. But but all of them have to go through the Canadian government for approval, and that's what I see as one of the values in maintaining medicine that is affordable.
And if it is the same medicine that you could get here in the States up in Canada, and if Health Canada is only, increasing it by a certain percentage per year, then that's even a greater advantage to establish a working relationship with Mark's Marine Pharmacy, versus trying to search the internet where there could be a lot of different scams going on with the tens of thousands of online operators who might actually, when you ask for a quote, be giving you an outdated medicine, or they might be stating their own inflationary prices as well. So it's something where I think for people to be able to have a broader understanding of exactly what the folks at Mark's Marine are doing, how they could utilize their services. I think it's very important. So I want to touch upon, if I'm a new patient, I go to, well, first of all, I might have watched TV last night, saw a whole host of drug commercials here in the United States that then asked me to go ask my doctor about it. And after they asked me to go ask my doctor about it, they also gave me about 20 seconds of side effects that, once I heard the side effects, I kind of said, well, I might need another medicine just because of these side effects. And so if I want to then be a new customer for Mark's Marine, how do I go about it? Like in terms of the initial contacting, how an order is filled, and then, I know that you guys then will ship it down because your website is canshipmeds.com, which is, something that, when people, because we want to make part of our mission is also to channel information, funnel it down, make it easy for our listeners, not only in the United States, but across the world, to be able to utilize it. So if you could touch on that, please.
Yeah, before I answer that question, I just want to make the point that you also just elaborated on the last question you asked, Rob, to why the medicines are so much less expensive here in Canada. So we're talking about the exact same medicines, many times even made in the exact same laboratory. But you talk about things and you see things like the prescription medicine commercials. I was in Arizona on a golf trip. Great golf in Arizona, I got to tell you. The States has some of the best golf in the world. But you go and you watch TV, every second commercial is a drug commercial. And who do you think is paying for those commercials? Over and above that, you go to the doctor's office, and it is a great thing that they provide you with the free samples sometimes, but also that gets factored into the price of the medicine. The drug reps and how the drug reps work with the doctors there, it's completely different. So that contributes to the high costs, and that's why the brand drug medicines are 50% more savings here, and the generic medicines can be up to an 80% savings. So again, we're talking about a huge savings, and ordering is really, really easy. First thing we always want to do is have our patients call up so we can discuss the medicine they're taking and the options that are available to them, and provide them with a consultation service. We are a full-service pharmacy. We are service-oriented, and we have specialists here with different medications and different categories of health that we can put them on the phone with to give them extra insight and information. That's step one. Step two is sending over the prescription. The prescription can be sent over by fax at 1-877-888-9805, so a really easy phone number. It can be emailed over to us, and I think we'll go through the email and the contact at the end of the show, and the website, which it can be emailed through there as well. So getting over the prescription, whether it be faxed, with today's technology, you can take a picture and email it, or you can scan it in and email it, and from there we set up the order over the phone. Again, we do have a website, and this can all be done through the website, where you can place the order online and upload the prescription, but because we're a full-service pharmacy, we encourage our patients to take advantage of those services, so we can, again, especially with the first order, so we can really answer all those questions in detail. So moving forward, you have peace of mind. because I think there's so many unknowns. The big question mark of I don't know what to expect, I don't know what I'm going to get or how long it's going to take, and all those types of questions. We can answer those in detail so you know exactly what to expect. Peace of mind is important.
Absolutely, and if you don't mind my interjecting here, I mean, essentially, as I've mentioned earlier, I suffer comorbidities as a result of my epilepsy, and I think we've already spoken personally about 3 medications that I have pretty much brought to you guys from my doctor here in the United States. Now, the question I have for you, which I'm sensing, is that you already know what my key prescription has been, which is Lamictal. However, when I've come to you about Keppra and when I've come to you about simple aspirin and other kinds of things, do you guys incorporate my whole treatment plan to determine the right mix of my multiple medications and therefore really educate me not only as a medication user, but as your plan of helping me lead a better quality of life going forward?
Yeah, again, we have different specialists for different categories, and to talk about my father's background, he's a graduate of 1973 from the University of British Columbia, who's stayed in educating himself, going to seminars around the world, and updating his education from all the different holistic components. So he's just one of the many health practitioners that are here. We have other pharmacists as well, and other pharmacy technicians. So we always want to look, again, at the whole picture. We want to look at it on a holistic perspective. So there's a lot of things we can do there.
Well, absolutely. As you improve a person's health, their response to their medicine becomes more powerful. So that's how the body works in a holistic fashion, and there's many things you can do. For instance, I'll give an example, a person with diabetes, many of them have neuropathies, the burning in the toes and the feet, and there's so many wonderful ways of treating that and removing it naturally and getting it better. So there's lots of things that people can do that they're not aware of.
Amazing. Now, let me ask you, in terms of alternative treatments, is that part of your holistic plan? For example, acupuncture or meditation, or is that something that remains distinct and separate with you guys?
Well, holistic health and prescriptions are one spoke on the health wheel. Practitioners who do, acupuncture are another. There's many different spokes on the wheel to make our wheel go smoother.
Awesome.
And here in our clinic and in our pharmacy, we don't have practitioners that do acupuncture, meditation, Reiki, but we do have a network of professionals here in the lower mainland of British Columbia that we trust and that our patients have had great success with, that we refer to.
Great.
So, and not only in Vancouver and not only in Canada, but because we have patients all over North America, and we work with doctors of all types. Many states we can refer patients to a doctor that can be helpful for a certain situation who might be a specialist in that category. So we try to be in many ways a one-stop shop for patients' health to provide that total healthcare solution.
That is great. I can see a whole integrative protocol here. Essentially, the name of my show is Frank About Health, and I can only say that you've been frank about a lot of issues related to integrative healthcare. I mean, I'm amazed. Every time we speak, I learn something new. I guess, is there any kind of way, other than your 800 number, that individuals with different illnesses like diabetes or other healthcare issues can reach you directly? Another phone number maybe, or an email address?
There are, and you mentioned diabetes, and that's one of the main categories that there's such a huge savings. We're talking a minimum of a 50% savings for the most popular medications. And one thing we get a lot of as well is veterinary medicine, where if it's a cat or a dog or a pet, who my pet is my best friend, and that's always basically going to be out of pocket. And things like insulin can cost up to and over $300 to $500 or more, whereas here in Canada it's always below $100. So that's a huge savings. So to get a hold of us is really easy. We have the toll-free phone number, which is 1-877-888-9265. We have our website, which is canshipmeds.com. So can, like the beginning of Canada, ship, the other word for deliver, and meds, medicines, shortened with plural with S on the end, so canshipmeds.com. And all our information for contacting, sending the prescription, a lot of the stuff we talked about today will all be on that website. And we always encourage patients, again, to call and talk to myself, Rob, or any of the great members of our staff here on a one-to-one basis.
So for all the pet owners out there as well, you could please join in and see the benefits. That was a shocking statistic that you just gave in terms of for cat insulin. What was the prices again?
In the States, it'll be $300 to $500 for a vial of insulin, and here in Canada, it's less than $100. And that's one of the medicines where the prices have tripled in one calendar year, and we had so many frustrated Americans calling us. And I personally spoke with patients who were in tears, that they were put in a predicament of what do I do at $500 a vial, some of them going through it in 2 weeks, some a month, some 6 weeks, but we're talking about a lot of money at the end of the year where it really makes people make tough choices, whereas with us it's a no-brainer to save that money, and again getting the exact same medicine, same manufacturer.
That is awesome. And we're about to take another break, but I have to say what I've learned about today, including about pets, is you definitely have a socialized way of medicine, but in a very productive way. Again, everybody who's listening to this show today, at Frank Healthcare on my Twitter feed, hashtag FrankAboutHealth. If you have any questions for these great guys or for me and Dane, we'll be back.
Are you into comics, movies, and pop culture at large? What about music and storytelling? Then you're in for a treat. This is Michael Dolce, your brand new radio host on talkradio.nyc. I've been professionally writing and drawing comic books, screenplays, and music articles for over 15 years. Catch my new show, Secrets of the Sire, Fridays at 11 a.m., and get the inside scoop on the pop culture universe you love to talk about. For more info, go to secretsofthesire.com right now.
TalkingAlternative.com.
Hey everybody, welcome to our final segment of a very intriguing episode of Frank About Health. I've learned a lot today, and I really hope that all of you out there have learned as well. These guys over at Mark's Marine Pharmacy in Canada, father and son duo, Rob and Jordan Rosenblatt. As far as I'm concerned, you are definitely my people who are going to keep my quality of life at a maximum. So I'm glad you've had a chance to talk today. I think we have some final questions on an economic issue, and I definitely will have some others afterwards. But everyone out there, at Frank Healthcare on Twitter.com, in my hashtag FrankAboutHealth. So go ahead, Dane.
Thank you very much, Rob and Jordan, for being with us today. I think we got a broad understanding about what the cost savings could be for people in North America, the United States. Also in terms of the ease at which you can place an order, send your prescription, have them filled, make a payment, and then live a better quality of life with an overall understanding that there's always a phone call away to have an educated voice giving advice on our medicines. I guess the one thing that I would ask is, looking at the growth of your veterinary medicines, where do you see that growing over the next couple of years?
It's really tough to say. I know that there are few insulins that come off patent here in Canada this year, whereas the States, they'll have a monopoly for many years to come. But products and medicines constantly are changing. The industry is constantly changing, and the prices and the distributors of the manufacturers. So really, we always just try to provide the lowest possible prices on all medicines right across the board. There's 30,000 plus medicines in many different strengths and sizes. So our goal is always keeping the prices as low as possible and really helping any individual with any topic of health save money. But there's definitely certain categories and certain medicines where the savings will be more because of the monopoly that the manufacturers hold in the States, where Canada here it's off patent.
Yeah, exactly. I mean, over the last year or so, over 4.3 billion prescriptions were filled in the United States, and Americans doled out approximately 375 billion US dollars. That's and that's only for people. Now we're touching on pets, so I'd like to get some more statistics on that, which I could probably...
I think my question would be, how many of those people aren't in the statistics because they couldn't afford the medicine?
Mm-hmm.
So it really is a tragedy. It really is sad.
Yes, and perhaps maybe they were prescribed something that they really did not need, and that actually cut into their overall spending. And so having the ability to get good advice on, instead of, if you have 4.3 billion subscriptions and you have a little over 340 million people, that's approximately 12 prescriptions per person. That's one a month. Perhaps maybe all those were not needed, but the ones that were needed, if they could get them at a better price through Mark's Marine Pharmacy, then that's a win-win for all. And that's kind of why we touched on the show earlier on, that this is definitely a topic that's too big to not know about. Within the health industry, we definitely look forward to being able to partner with you, promote you, educate the average person in the United States. Also, for the audience that's out there listening, the doctors, the parents, the grandparents, children, it's something that to have that knowledge that there are alternatives, and it's only a phone call away or a click away at canshipmeds.com. I think that's something that definitely, you've added a lot of value, during this, past hour.
Yes, I mean, Frank About Health is not just a radio program. It is also a blog that is still in development, but we know that both aspects of Frank About Health, in addition to our social media platform, will be highly educational for you guys as you continue to go word of mouth on an exponential level with us. So we definitely look forward to working with you guys in the future. Simultaneously, I'm amazed at what I've heard today, not just about pets, but also about the patent issues, and not to mention the pricing issues. I mean, I'm actually looking at a bottle of a package you submitted to me about 3 months ago, and I see that not only from the label perspective are you articulate about your website and your phone numbers or whatever, but you're also indicating specifically the milligrams that I take. You're telling me how many to take, not to mention how many times per day to take. I mean, it's as if that not only am I getting my prescription refill, but I'm getting a free lesson at the same time. So I have to tell you guys that I really appreciate your guys' work. I do want everybody out there to continue to reach out to my Twitter feed at Frank Healthcare, as well as my hashtag Frank About Health. Any questions, especially related to these guys, they just need to understand more about all those needs you have out there. I mean, we've been talking about epilepsy, the social impacts of alternative healthcare. We've been talking or touching upon diabetes. We're talking today about pet care. Not to mention, of course, there are the medicines out there and all the many expensive items that unfortunately people with chronic illness continue to face each day. Dane, you mentioned about insurance rates rising. I mean, not to mention, of course, in the group standing, never mind individual plans, they are definitely being impacted. Deductibles rising. I mean, essentially, I learned that healthcare in the United States is a mortgage. Now, I would like to say that's just my opinion. Yet, I would also like to say that in order to counteract that opinion and for everyone out there to benefit from what you've heard today, both on my show as well as with these guys at Mark's Marine, again, please reach them at 877-888-9265, canshipmeds.com. And at the same time, stay tuned because they will be back. We just don't know when yet. Jordan and Rob, thank you so much for being here today. All I can say is I will be in touch with you even today about some new refills that I need to take care of. So you're very welcome. And if you have any questions for me as a patient of yours, I'd be more than willing to answer them because, again, you guys to me are stars as far as I'm concerned.
Well, thank you.
We appreciate that. And it's those kind words and it's hearing the things and the testimonials that really keeps us going and makes us work hard.
That's why we come to work every day.
Yes.
Yeah, and one of the things we'd like to offer all your listeners was that if anybody calls us directly, right up until the end of the month of June and mentions that they listen to this show, we'd be happy to offer them free shipping on their first order. So a little extra incentive to just learn about the experience and to experience it firsthand. So again, mention the show to get free shipping for the whole month of June.
Awesome, absolutely. And I do have to say, this is being broadcast through the internet, so there are people in Canada listening to this show right now, correct?
Yes.
Awesome. And then I guess I could also ask you, I think it was touched upon, but I know people in Europe and Asia and India and other international countries are also listening to this show in their respective time zones. Do you guys actually deal with those countries in any capacity other than the United States, which again I understand is over 95% of your business?
We really focus on North America. America is our neighbor. America is close. And in Canada, we get a lot of people that call up. It's really fast delivery, and we have some unique naturopathic health products. Even our filter system for what we keep on the shelf, we really only keep the best of the best, so patients rely on us for that. So that's where we focus our efforts.
Awesome.
And Rob and Jordan, is that free shipping offer good for, say, if my dog Rover calls up as well? Does he get his meds shipped for free?
Absolutely.
Okay, I'll have him call you tonight then.
That sounds kind of rough. No, a little joke.
Got that one.
Trying to do what I could.
Nice.
All right, so I think we still have some time here, but I definitely welcome everybody here.
Frank, how did you find out about us?
From my doctor. Essentially, I'm just going to give a testimonial here right now. As I said, I have Lamictal. Lamictal has been my drug of choice since 2002, and I used to have $10 copays until the Affordable Care Act was actually enacted, and they increased my copays to $500. Essentially, I was told without my insurance, I'd have to pay $2,000 for the bottle per month. And so I simply said, I'm no longer dealing with you guys. Get me someone affordable. And they said, Mark's Marine Pharmacy. I think they faxed my prescription to you guys. And literally, you got me a 3-month supply for $1,000 total. In this country, it would have been $10,000.
Wow,
that's how I heard about you, through truly word of mouth.
Wow.
And so that's what I hope that this show will do. Make your word of mouth business more exponential. And so far, as I said, as a result of promoting this show with you guys being on it today, I've got so many hits on Twitter and Facebook, and I'm sure that when we work together in the future, in whatever capacity that is, we will definitely have an integrative approach towards being frank about health. So, ladies and gentlemen,
I think that's the main component to is word of mouth.
Yes.
Because again, 99% of those places out there that sell medicine, not pharmacies, not pharmacists, they're marketing companies.
Yep.
So they're really easy to find on the internet, whereas for us, we're not. As a pharmacy, we know, to be frank about it, we know nothing about marketing. So we rely on our patients to tell other people, their friends, their family, their coworkers, and people tell people. And one of the things that we do for our patients is we provide them with $25 savings for a referral. That way we offer the highest quality medicines at the lowest possible price and give the best service out there. And people are happy to tell their friends. And again, I get to hear testimonials like yours, Frank, on a regular basis, and always makes my day. Puts a smile on my face.
You are an inspiration to how this show even began, just so you know. So, ladies and gentlemen, we're about to sign off, but reach me at Twitter, at Frank Healthcare, #FrankAboutHealth, and we will continue this discussion virtually, especially when the show is ready for mass distribution. Ladies and gentlemen, thank you again, and see you next week. Dane, thank you again for being here.
Okay, bye-bye now.
Thank you, Jordan. Thank you, Rob.
Bye-bye.
Thank you.
Bye-bye.
Talk to you soon.
You got it.
Are you into comics, movies, and pop culture at large? What about music and storytelling? Then you're in for a treat. This is Michael Dolce, your brand new radio host on talkradio.nyc. I've been professionally writing and drawing comic books, screenplays, and music articles for over 15 years. Catch my new show, Secrets of the Sire, Fridays at 11 a.m., and get the inside scoop on the pop culture universe you love to talk about. For more info, go to secretsofthesire.com right now.
Hey, all you crazy listeners. Looking to boost your business? Why not advertise on Talking Alternative with very reasonable rates? Interested? Simply email at info@talkingalternative.com.
Hello, I'm JC.
I'm Joan. And welcome to 21st Century Entrepreneur.
We bring education,
insight,
knowledge,
awareness,
trouble,
craziness, and fun
for you, the entrepreneur who's looking to build your business
and your community. Listen every Friday from noon to 1 Eastern on talkradio.nyc. And you can tweet us at 21st CE Radio or Talk Alternative.
You're listening to the Talking Alternative Network at www.talkingalternative.com. Now, broadcasting 24 hours a day. Talking Alternative.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays 12 noon on talkradio.nyc.
You're listening to the Talking Alternative Network.